We've been talking mostly at the macro level.
Mm-hmm.
Let's go to the micro level for a minute. And I want to ask you what you would like to see made different in the healthcare system that would improve the ability of your people, the nurses, to do their job.
Okay. So let me talk about our priorities in terms of the American Nurses Association. And again, that's our membership group and what we focus on. So one of the things that we want to see is full utilization of the nursing workforce, because we believe if there's full utilization of the workforce, that provides us with the opportunity of improving cost, quality, and access. The other thing that we would like to see is focus on the workforce. For example, the Health Bureau's profession indicates that by the year 2020, we'll have a shortfall of almost 1 million nurses. Mm-hmm. We have 2.9 million nurses in America. We have roughly a little over 800,000 physicians. Yet when we look at the monies that are allocated annually toward education of our workforce, we know that about 81 million is being spent annually on medical education, where only, in contrast, 156 million is being spent on nursing education. We know that right now, the last academic year, 2005-2006, that we have statistics for, that 88,000 qualified nurses were turned away. And that's, again, because of our capacity. And so not only do we have an overall nursing shortage, but we also have a critical shortage in academia in regard to our nursing faculty. So we really must look at the pipeline as well.
And what about the staff-to-patient ratio, which we hear so much about?
Well, we believe that is important, and we actually have introduced legislation over the last 5 to 6 years. Every year we try to garner bipartisan support for that. Obviously, it is about a ratio, but there's many variables that impact on what is that right number. It's the kinds of patients that you have, how ill are they, how experienced are your staff, what kind of support staff do you have, what is the geographic layout of your unit. So lots of variables that go into that. So we believe that to mandate at either the national or the state level a specific ratio is not in the best interest of patient safety. But what we should have is national legislation based on principles that says that every institution must utilize these principles to establish unit by unit what is that ratio. And that should be public knowledge so that every consumer who is seeking care understands what is the staffing on that particular unit.
I want to switch gears for a moment. I noticed in your bio that you spent many years in the military.
That's correct.
In the Air Force. What would you like to see from the military medical system brought into the wider consumer arena?
Well, I'd go even back to the Federal Employees Health Benefits Program. Mm-hmm. Because in essence, even though that's not the particular program that we fall under, if you wear the uniform, it's very similar. So again, from day one, there's emphasis on primary care, there's emphasis on prevention, and there's emphasis on maintaining independence, functional independence in terms of working with people. And if those things transferred over to the public sector, into generally what would be available to everyone, I think our nation would reap the benefits of that because we would be more productive, because we would be healthier, and this would really enable us to better compete in the global marketplace, the global economy.
I want to ask you a final question. It's one I ask many of my guests in this interview series, and that is, what is your realistic expectation that when there is a new administration in office in January, that there will be changes made, whatever they may be, but changes made to the healthcare system?
Well, obviously, who's elected is going to determine to some extent what happens, when it happens, how it happens, where it happens.
If it happens.
Maybe even if it happens. But we believe that the first thing that should happen, regardless of who's elected, is that you really should look to the future and you should have a national vision for where it is that you want to go with health policy. And once you know where it is that you want to go, then you should look at where you are today and what's the gap, what's the deficit. And then you need to bring together all of the interested groups and concerned individuals and try to tap into the collective knowledge, wisdom, and experience of all of these individuals to identify what are the steps that we need to take to get there. And if you take it a step at a time, we can get there. It seems overwhelming when you try to look at it as a whole, but you have to start somewhere. And if you start somewhere, then the next step will come easier, and eventually we can get there.
Do you believe that the nurses and the Nurses Association, I guess, have a real voice at the table? Or I know nurses often complain that they are overlooked. Do you feel some of that in this debate?
Well, what I feel, it's not just in this debate. We're the most trusted profession in America. We know that because of the survey that's been done almost for a decade now. The only year that we weren't at the top of the polls was 2001, and the firefighters were several points ahead of us. So what I believe is, though, that trust and value is different. You can trust me, but you may not know how to value me. Because in our system, in our country, generally speaking, hierarchy, where you are within a hierarchy in terms of status, or where you are economically, in many ways, is how our society tends to value people. And when you look at the healthcare industry, nursing doesn't really fare very well there. If you think about a hospital bill that you get, do you ever see nursing care broke out? You don't really see that. So really, our nation doesn't know how to value nurses. So I think that is something that plays into this dynamic at times.
Okay, thank you so much. It was good to have you here.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.